Oh, hello. I'm Sheikh. I'm one of the oncoplastic breast surgeons working in Royal Cornwall Hospital Trust. I'm one of the 4 surgeons working here. Reconstruction surgery generally, to most of the people, mean that once we have removed the breast, which has to be done in certain conditions, or if there's a patient choice. And the purpose of reconstruction is to rebuild the breast, and there are many ways of doing it, but the main aim of doing that is to try to make the reconstructed breast as normal as possible. Reconstructed breast does not really mean that patient will feel that the breast is back. It's not their breast, it's a reconstructed breast. But the main advantage is that psychologically patient feels that they have the breast mound, it looks like breast, although the feelings are not there, but it does look like. And there are many studies which have shown that patients who are undergoing mastectomy and have reconstruction to give them the breast back, they do so much better psychologically. And this has been shown in many studies that it is very beneficial for the patients. Breast reconstruction is something which should be offered, according to the NICE guidelines, to every woman who is going undergoing mastectomy. If it is not offered, then it is patient's right to demand and discuss mastectomy, after mastectomy reconstruction. Once the diagnosis is given to the patient, these options are discussed in details and preferably discussed in a special clinic which we call a reconstruction clinic, because there are very different ways of doing the reconstruction, and the patient has to be aware of all these options so they can make an informed choice as to what will suit them. The way it works is that once the diagnosis has been given, option of reconstruction is given. And the next step after that is that the lady or patient goes and sees a reconstruction nurse who's called Sara. She goes through all the options and shows them a photograph of different type of reconstruction and gives them information which is in form of leaflet, gives them web addresses on which they are authenticated literature on reconstruction. Once that step is done, patient comes back to the surgeon who's doing reconstruction, and we then discuss all the aspects which are not clear by this time. And once that information has been given to the patient is in a very good position to decide as to what method of reconstruction they will take.
Hello, my name is Sara. I'm one of the clinical nurse specialists in the Mermaid Centre. I've been working here for 7 years now, and I'm part of a big team of breast care nurses looking after all the ladies from the time they come into the unit until the time we discharge them 5 years later. The decision for reconstruction is often led by the patient, but not just solely by the patient. It is a team decision. It is discussed at our multidisciplinary team meeting. It is discussed with the surgeon and of course with the oncologist. And at the end of the day, it's down to the patient as to what they want and what the surgeon is able to provide for them.